Hello, hello. We still have a few minutes before we're going to get started. We've got about 8 minutes to go. I just wanted to do a quick video audio check. So if you're joining on YouTube, if you're joining on Instagram, or if you're joining on Zoom, let me know if you're hearing and seeing me okay. Just going to do a quick audio video check. We still have 8 minutes till we get started. Want to make sure technology is working for me. You guys seeing and hearing me okay? Maybe? Awesome. Looks like you guys are seeing and hearing me. Oh, amazing. We've got 7 minutes till we get started. I always try to start it a few minutes early because technology doesn't always like to work how we would like it to, but today tech is working amazing. So we're going to get started shortly. Go get a cup of coffee, go get a snack, and we'll plan to start right at 30 minutes after the hour, wherever you are in the world. See you guys shortly. Okay, everyone, we still have 2 more minutes before we get started, but while we're waiting everyone to join us, I want to make sure and give you a little introduction to myself. By the way, welcome to everyone who's joining us on TikTok, on Instagram, on YouTube, on Facebook, and on Zoom. We've got all our platforms running today. But my name is Rachel Taylor. I have been in education now for 3 years. So I started off in the ICU. I did that for a little while, and then I went and worked with veterans. While I was doing that, a BSN program reached out to me and asked if I'd be interested in being their academic success tutor for their nursing students. So I worked with students from pre-nursing all the way until from pre-nursing all the way until they passed their NCLEX exam. Super rewarding, super fun job. I absolutely loved it. And here's where I found my burning passion for education. And then after doing that for about a year, then I found Archer Review. One of my students actually had used it and said how helpful it was. More of my students used it, and they're like, this is the product, Rachel. Like, this is helping us pass. And so I gave Archer Review a kudos, like, hey, your product's great. My students are loving it, and it landed me to being here. So I've been with Archer now for 2 years. I'm the senior manager of NCLEX services. So all things NCLEX is kind of my thing, and I absolutely love it. My favorite thing about education, since we have 1 more minute before we get started, my absolute favorite thing when it comes to education is that sometimes students don't think it's going to be doable for them. They don't think they're going to be the one that passes. They don't think that they're ever going to reach that goal. And I see people who think that reach the goal. I see them exceed their goal, and it is the most rewarding experience. All right, it looks like it's about time to get started. Awesome on TikTok. Someone said they just passed their exam. Amazing. Glad to have you here. If you guys know other future nurses, feel free to share this video, this stream. Feel free to tag individuals in the stream as well if you know anyone else who's going to go take their NCLEX soon. So I want to know from you guys in the chats, let me know, where are you joining from? Where are you joining from? Where in the world are we located? So I'm in South Dakota. That's where I'm currently located. My family moves quite a bit though. How about you guys? We got Philippines, awesome, welcome. Ghana, amazing. Norway, Finland, awesome. India, amazing. Canada, Venezuela, Nepal. Okay, Boston, California. Several from Nepal, amazing. Peru. I think you might be the first student I've seen from Peru, unless I just have missed it before. Okay, we're going to get into that. Someone just asked a question about, hey, they've passed the readiness assessments, they feel anxious, they're not sure if they're ready. We're going to talk about all of that today. Absolutely, we're going to get into that. So really what we're going to cover today is before the exam, what that should look like, adequate prep. We're going to talk about exam day itself because exam day can be stressful. There's a lot of do's and don'ts that I want to share with you. Taking the NCLEX and then after the exam and what that kind of looks like, your results. So we absolutely will have time at the end for questions if you have them. So we'll do that kind of all at the end. But yes, I might say your name wrong, Nenny. I definitely want to get that question answered for you. So before the exam, I want you guys to take a moment and I want you to think, when is your exam scheduled for? When are you scheduling your test? Because the key thing here is that we have adequate preparation. I want to make sure that you prepare for this exam successfully. My mindset is, let's make this next attempt your last attempt. Whether you're a first-time test taker, whether you have tested 10 times before, I want this next attempt to be your last attempt, which tells me if I want that, I want to ensure that our prep is adequate, that you spend the right amount of time, that you prepare what works for you. Okay, awesome. Let's see, when are people scheduled for? March 29th. Okay, you got some time. Perfect. Absolutely. March 1st, feeling anxious. We can take a few minutes to talk about test anxiety at the end here. That's definitely something a lot of people struggle with. All right, April 5th, Friday. This Friday, amazing. Good luck, good luck. February 21st. Okay. So really my big question to you guys, and you don't have to answer this in the chats, but just do a self-assessment here. Are you ready for this exam? Or do you still have more prep to do? How have you prepped? Do you feel like you've gotten good takeaways out of every study session that you've had? I want you to ask yourself those questions because adequate prep is so important. We at Archer Review, our number one package that we recommend to the majority of students is the SurePass combo. The SurePass combo comes with a lot of things. Basically, everything we have to offer is included in SurePass combo. You get our question bank that has over 2,800 practice questions. You get our on-demand videos, which has over, I think it's like what is it, 70 hours, over 70 hours of on-demand videos. You get access to our 3-day live review. You get to attend that once. You get our live lecture bundle, which includes live case studies on Monday, Wednesdays, and Fridays. It also includes live lectures that happen on Tuesdays and on Thursdays. So it is very extensive. It includes basically everything. So if you are just starting your journey to NCLEX success, you haven't prepped yet, then I would really encourage our SurePass combo. If you're like, ooh, I don't know exactly which combo would be best for me, this would be the one that I would recommend, that SurePass combo. Now, when it comes to applying and registering for the exam, because I want to make sure that you understand this, it is a two-step process. So if you haven't done it yet, several people are telling me, hey, I haven't applied yet. I haven't registered. I don't know what that looks like. So this two-step process includes first you have to apply to that nursing regulatory board. What they are going to do is they are going to assess, did you meet all the requirements to apply? Did you graduate from a nursing program? Did you get fingerprinted? They want to make sure, you are who you say you are. So that's the first step. Then the second step is you have to register for the NCLEX on Pearson VUE. That registration is active for 365 days. So you've got some time, but you need to register. That's the important part. You need to register. So we recommend at least 30 days of solid studying after graduation. So if you just graduated, if you're a December graduate, I want at minimum 30 days. Okay, 30 days of prep, at least 30 days. Now, if you didn't just graduate, if you don't fall into that category, then I really encourage at least 6 weeks of prep. 6 weeks of prep for this exam. Now, let's say you're a repeat test taker. You're like, oof, Rachel, I have tested 3 times. I've tested 4 times, 5 times. And you see that intense prep package maybe isn't for you, then the 12-week plan, our study calendar, is what I want you to utilize. Now, somebody said, which is the best? Our best package is the SurePass combo, and I would follow the 6-week plan. And if you work full time, you've got kids, you've got a lot of time commitments, the 12-week plan. That's the best. That's my top recommendation. Awesome. Karen just let us know on TikTok that she has the SurePass and loves it. That's amazing. I'm so glad to hear that. I love it too. It is great. Now, when you get to that exam, I want you to prep for it now. Because when you get there, you may have some anxiety. You may feel some extra stress around this exam. So, what I encourage you to do is I encourage you to take readiness assessments like they're your NCLEX. So, instead of taking readiness assessments in your own home when you're comfortable, I encourage you to actually go ahead and take these readiness assessments at a coffee shop, at a library. Take them somewhere else other than your own home. And the reason why I say that is because I want you to try to simulate what that test anxiety is going to feel like. Because if you know what that test anxiety is going to feel like, you can work on it. You can try to work through it. So several of you were telling me, Rachel, I'm having some anxiety. I've gotten 4 highs or very highs consecutively on readiness assessments. Somebody said, hey, I've got 8 of them, but you're still feeling this anxiety. Awesome. Emma, so glad you passed. Thanks for letting us know. So if you're still feeling this anxiety, here's what I want you to do. I want you to take a moment and I want you to think of what's the stem of the anxiety. Is it that you've accepted a job and they've told you if you don't pass, you don't get to keep that position? Is it some family member who keeps saying, hey, Rachel, when are you going to test? I thought you graduated 6 months ago. Why haven't you taken this exam yet? How come you're not a registered nurse yet? Seen family members do that. Is it that you have a fear, a worry, a concern? Whatever the root of that anxiety, I need you to know what it is. And if it's not to do with you and your success, get rid of it. Don't let somebody else put a bunch of anxiety on you. What I want you to do is I want you to do this for you and whatever your why is. Now, you still may have anxiety at that moment. I personally am someone who struggled significantly with test anxiety. I'm in my master's program right now. I still get test anxiety. But when it comes up, I practice what I preach, right? So here's what I do when I'm taking an exam and I start to get that test anxiety. So for test anxiety, what I do when I'm in the test, when I'm in practice, is number one, I know my first indicators. For me, I turn bright red. Like the color of my jacket, that's the color my face is going to turn. I can't hide it, right? And then my heart starts to beat, and I get sweaty. I get really, really hot. So when this happens, what I do is I stop myself. I have to know this, and then I pause. So I take a pause, I close my eyes, and I take in 3 big deep breaths. And you guys can do it with me now if you want. Then again, in. One more time. And just doing it right now, I don't even have anxiety. And that helped release some of the anxiety that I was barely feeling, right? Then what I want you to do is tense up your shoulders and relax them. And lastly, a mindset check. For me personally, and this might not be you specifically, but when I get test anxiety the worst, when it's to the point that I just can't answer questions successfully, I'm kind of struggling, what I have found works the best for me is I like to just tell myself, hey, I've got this. I'm worthy of this. Because when I don't, when I let that negative mindset spiral, my anxiety is going to spiral with it. So I found that that can be very, very helpful. The other thing is go in and do the best you can. Nobody expects you to be perfect. Nobody expects you to, get every single question right. So what I want you to do is I want you to go in there and I want you to do the best you can. And that is all that anybody can ever ask of you. That's all that anybody should ever expect of you. Now, if you're joining on Instagram, I am sorry, it's just slightly cut off because my slides are a little larger for the other platforms. You can join us on YouTube. You should be able to see it there pretty well. Now, the next thing is your authorization to test. You've applied to the state board, you've applied with Pearson VUE, and you're just waiting now for your authorization to test, which tells you, hey, you're ready to take this exam. Now, to take it, you have to get that authorization to test to actually schedule your date. Now, with this, you typically have about 90 days once you get your authorization to test to actually go take the exam. You've got about 90 days that authorization to test is good. That validity date cannot be extended. It cannot be changed. So get the exam scheduled. This is why I emphasize this, because each state board of nursing is a little different, but the average is 90 days. So make sure that you know what your state board of nursing's rules are and how long that ATT is good for, that authorization to test. Again, typically 90 days. So get the exam scheduled. And then if you need to move the exam, you're maybe not ready and you're like, oh, I need 1 more week, then you can reschedule it. But get the exam scheduled. The other benefit The other benefit of scheduling this test is that when you get it scheduled, okay, when you get it scheduled, it's going to motivate you. It's going to motivate you to do better. It's going to motivate you to keep studying every day. If I have a test a year from now, am I going to start studying for it now? Probably not, right? That kind of goes against human nature to do it that way. So instead, we want to start, getting that authorization to test so we can start motivating ourselves to study for that test. So how can you prepare well with Archer Review? We've talked a little bit about this, but I do want to make sure that your next attempt is your last attempt. So number one, consistency is the key to success. If you've been studying here and there, you've been studying kind of when you want to, but not as, scheduled, not on a regular basis, you're not studying consistently. You need to be studying every day. Now, again, this is going to look different for each person. So for me, right, I work 5 8-hour shifts. So because of that, I can study each evening or each morning, and it works well for me. But if you're working 3 12s, the reality is you're probably not going to be able to study a whole lot on those days that you're working 12-hour shifts. So what I would encourage you to do instead is on those days that you have those 12s, just do something short. Answer 10 practice questions, go through 10 flashcards on Pulsed In. Do something because something is better than nothing. Now, somebody said, hey, my exam validity expired. When that expires, do I have to pay again? Unfortunately, yes, if that's expired, you have to do that whole process over again. And that's why I encourage you, take that test, get it scheduled, get it on the calendar. Don't let it expire because one, it's wasting your time, but it's wasting your money. I don't want you to waste your money. And so once you get that ATT, please go schedule that exam. Now, what I want you to do is I want you to set a goal of getting 4 highs or very highs consecutively on readiness assessments. Once you've accomplished that, you should feel very confident. But I want to make sure that you're actively studying. Because if you're just passive, if you're like this, okay, yeah, I get the answer, yada yada, you're not going to learn a lot from that. You need to be active and engaged with the material. So to be active and engaged with the material, what I want you to do is to talk yourself through it. Can you explain the material for somebody else? If you're not able to explain that material to somebody else, then what I want you to do is go back to the concept, go back to that core information. Now, somebody said, can you schedule the test before we receive the authorization to test? No, you have to have the ATT. That's like the golden ticket that allows you to actually schedule your date. You are not allowed to schedule it without an authorization to test. Okay, trying to keep up with the questions here. All right. So again, ask yourself these kind of questions after you've gone through a topic. What did you learn? What connections can you make? What questions might the NCLEX ask you about this content? The other thing that I want you to keep in mind is that studying for at least 6 weeks is the most beneficial. I would encourage you to spend at least 6 weeks studying for this exam, okay? 30 days is my absolute minimum if you just graduated, but 6 weeks tends to be a little bit better. And here's why. If I review material a little bit each day for, let's say, 6 weeks, I'm going to get a lot out of that. If I only review material each day for a couple weeks, I'm not able to make those connections. My ability to critically think and utilize clinical judgment might not be there. And that's why it's so beneficial to take a longer amount of time. But when you take that longer amount of time to really make sure each study session is active, engaged, and valuable. Students ask me all the time, how many hours should I study? How many hours should I study a day? And yeah, the average is 4. 4 is the average, but that's not how I want you to determine when you're studying and not studying. This is what I want you to ask yourself. Am I burned out? Am I to the point that I am unmotivated? I'm getting nothing out of this. If you're to that point, step away, take a break. It's not worth it. The other thing is, are you active and engaged? Are you learning from this material? What are your key takeaways? If you can't do that, you've burnt yourself out. Step away and take a break. Burnout is so real in nursing and studying for this NCLEX exam, and I need you to be aware of burnout. I need you to know when it's happening. I need you to be able to try to avoid it. And if you are struggling with burnout, what I want you to do is I want you to remember your why. I want you to think about, why did you go to nursing school? Why are you working so hard to pass this exam? And when you do that, that should hopefully help motivate you and help push you through that time of burnout. Now, 1 week out, somebody said, hey, can you give me quick tips? I'm about to test. We're getting there. 1 week out, this is what I want you to start doing. I want you to get used to the routine of exam day. If your exam's at 8 a.m. and you don't normally get up till 8 a.m., that's a problem, right? You need to get up. You need to follow routine like you would on test day. So for me, I love things in the morning. I am not a night owl. I'm not good if I stay up past 10 p.m. So for me, I'd be the person that would schedule my exam at 8 a.m. So if I know that my testing center is 45 minutes away and I'm going to be there 30 minutes early, well, then I'm probably getting up at 5 a.m. on exam day. So I need to do that for a week. Because if I'm used to getting up at 6, 7, and now all of a sudden on exam day, I have to get up a whole couple hours earlier, it's going to throw me off, right? And so I need to make sure I get used to that routine. My sleep cycle is similar because sleep can be affected by test anxiety. So you want to make sure you're getting good quality sleep. Next thing I want you to do, 1 week out, look at your last 3 readiness assessments. And are there any trends? Do you notice that you're weak in certain areas on several of these? For example, you may notice that adult health is low. Well, adult health by itself is not a really good indicator of where you're weak on. So what I want you to do is I want you to look at, okay, I want you to look at, is it respiratory? Is it neuro? Is it endocrine? What specific adult health area is it? Maybe you notice you're low in cultural considerations or you're low in diets and nutrition. It gives you that week then to really review that material one more time. I would take personally a full day to review each week area so that way you know that you got it down. The other thing, keep answering questions daily. Don't stop taking them. Now, some of you have maybe already made it through the Q bank. So if you have made it through the Q bank, what I would encourage you to do is I would encourage you to go back through and answer your missed questions. Because when you answer your missed questions, what this will do is this is going to help you understand, what did I miss? Why did I miss it? How can I then get it right the next time? Okay. Now, the next thing is the day before your exam. What should you do? The answer is nothing. I don't want you doing practice questions. I don't want you cramming the day before. Reality is if you don't know it 24 hours prior to the exam, you don't know it and you're not going to learn it. So what I would prefer that you do is take that day before to relax, to de-stress, spend some quality time with your friends, with your family, go on a walk, do something that helps de-stress you. Then what I want you to do is I want you to tell yourself that you've got this and that you're going to do the absolute best you can, because nobody should expect more of you than that. That's all I expect of you. If you go into the exam tomorrow and you go do the best you can, I'm happy and I'm proud of you, no matter what that result is. Now, I want you all walking into that test like you're going to have 150 questions. Now, it may shut off before 150, but I want you to go in with the mindset that you're getting that full exam. And here's why. Because if you don't go in with that mindset, you think it's going to shut off at 85. Well, then the problem is going to be, oh, shoot, I'm at 86. I'm at 100. Am I failing? Am I passing? I don't want you worried about that. Go in with the mindset of you're getting 150 questions and do not self-analyze during that test. Don't count the number of static questions you've had. Don't count the number you think you've missed. Now, I know it's tempting because you know who did that? I did. I counted the number of SATA questions that I had on the exam. And you know what it did for me? It caused my anxiety to build. It caused me to feel a lot more stress that was unnecessary and definitely did not help me. It just hurt me. So if it's not something that's going to benefit you exam day, don't stress it. Okay. Don't worry about it. I know easier said than done, but that's why I encourage you to take control of your test anxiety now. Don't let that test anxiety take control of you. Now, if you're not sure if you are ready for this exam, you're like, oof, I don't know, Rachel. I'm not exactly sure if I'm ready for this test. You feel a little on the edge. Am I ready for this test? Am I not ready for this test? Then I encourage you to seek out one of our private tutors. Our private tutor team is incredible. Two of our private tutors, Allie, she does night private tutoring, and then we just added another tutor, Shelly, who does day tutoring. They can look at all of your scores that you have done with our to review, and they can tell you, hey, you're ready. Hey, we might want to hold off on a week or two. Let's work on these things, and then they'll help you on those things. So if you're not sure, if you're letting anxiety and worry hold you back, my best recommendation is to do a private tutoring session. Now, private tutoring is $75 an hour, but the benefit is significant. Students have come to me for private tutoring and they walk away knowing if they're ready to take that exam or not. And with that encouragement, it usually can boost your confidence. And the NCLEX is just as much a mental battle as it is a knowledge battle. So make sure that you've got that mindset in the right place. All right. Any questions about private tutoring before I move on? Any questions on private tutoring? Okay, I don't see any. Someone asked, hey, am I going to be able to play this back? We don't always keep them up, but we may post this one on YouTube if anybody is interested. Okay, awesome. I don't see any questions on private tutoring. If you think of any, let me know. I'm happy to answer those. So we made it through. We made it through a day out, a week out. We've registered. We've got all that stuff taken care of. And now we're to exam day. Whew. This is when the test anxiety comes in. This is when it gets a little overwhelming of what the day is going to look like. So first of all, when it comes to the testing center, I want you to know exactly where your exam is going to be. If you have never been there before, I want you to actually drive there the day, the week before, so you know exactly where you're going to park, where's the building, because I want nothing else leading to anxiety on exam day. So I want you to really get there early. Anything you don't need, leave it in the car. Your phone, your smartwatch, leave it in the vehicle. You're maybe like, why would you not bring your phone in? And here's why. I had a student once who her phone was in her locker and it kept vibrating during the test. And because it was vibrating, she was asked to leave the exam. She did not get to finish her test. It was an automatic failure. That is why I tell you to leave your phone in the vehicle. You don't need it in there. You can't utilize it in there anyway. Leave it in the car. Bring in your car keys, bring in your ID, and bring in a snack and water. And that is it. I would not, okay? I would definitely would not bring in my phone or a smartwatch. Now, someone said, hey, I need private tutoring. It looks like one of our team members in the chat on YouTube just posted that link for you. So you guys should have that. All right. Now, the next thing with this is make sure that your ID matches your name. So if you recently just got married, if you recently just had a big life change, make sure that your ID, your first and last name, is the same on that ID as what it was when you registered. If it's not, they will not allow you to take that exam. You need to make sure your ID matches the name that you registered. And then they're also going to do this palm vein scan. So what it is, you put your palm on this thing and it's going to scan your veins and it's going to know that this is you. You are who you say you are. And then if you leave, to get a snack, to get water, whatever, and you come back in to take your test longer, your hand, they'll rescan you in or let's say you have to go to the bathroom, they'll rescan you in before you're allowed to go take that test. What that does is that it really prevents you from swapping, like having someone else finish the exam for you. Now, somebody said, hey, I've taken the NCLEX 4 times. If I take private tutoring, how long is enough and what do I recommend? So this is different for every person. What I actually recommend, if you are interested in private tutoring, start with 1 session. I'll show you guys how to book those at the very end of today, but start with 1 session and then let them help you plan it based off your lifestyle, your schedule, and your personal goals. It looks different from every person. I can't give like a one fits all answer here because I have worked with students. So I had a student pass on her 17th attempt. We met twice a week for a long time. And that's what worked for her. I've had other people be on their 9th attempt and they meet, with us every other week and they do well with that. So it's really what you need and what's specific to you. Now, someone asked me, hey, what type of snack would you bring? So I'm a little specific in the snack that I would bring. You don't have to bring this, but my personal recommendation would be to do something that was high protein and high in complex carbs. And here's why. Fuel your brain. You're in that test for potentially 5 hours. Your brain needs some fuel. And if it doesn't have any of that fuel, it can be hard to finish that exam strong. Typically, I recommend taking a break around question 110 and having that snack so that you really finish the exam strong. What I do recommend is this is me being extra, but I recommend putting it in like a clear sandwich bag. So that way they see that you're, and you confirmed you can have your snack. They look at it, they can see that there's nothing in the bag. It's just a snack. I know that's me taking it like totally one step further, but I would rather you do that than there be any extra questions about, oh, is there anything, in that package, or something that's totally packaged and never been opened would probably be okay too. And then what I want you to do is have something fun for after you finish the test. I don't want you going home and sitting around and waiting for 48 hours to get your quick results. I want you, right, to go have something fun planned, go out for dinner, go see your friends, go do something, because otherwise it can lead to a lot of anxiety, a lot of worry, a lot of doubt. I will say lots of people have been emotional after the exam. They don't know how to feel. They're not sure if they passed, if they failed. Don't worry about it until you get the quick results. You're not going to know. A lot of people think they failed when they passed, so I would not let that hold weight over you. Wait till you get those quick results. And until then, just distract yourself the best that you possibly can. Yeah, absolutely. Someone just said, hey, I am pregnant. My exam is next week. Congrats, by the way. If I need to take a break to just breathe and use the bathroom, can you? Absolutely, you can. Sounds like that anxiety is playing a role in you feeling ready for this test. Work on that anxiety. But yes, you need to go to the bathroom. Please, please do. But beware, every bathroom break, the time is still counting. So if you are someone who struggles with time management during the test, work with a private tutor on that before you take the exam. Now, we already kind of talked about this, but when you don't know the answer, this is what I want you to do. I want you to ask yourself what you do know. Look at one answer choice at a time and eliminate what you know is wrong. I want you to choose your answer based on your gut feeling. Whatever your gut tells you, choose that answer and move on. And move on. Here's why. If you debate, if you go back and forth with yourself, it's going to make it a lot more challenging. You're likely going to change it from a right answer to a wrong answer. So what I encourage you to do is I encourage you to choose your answer and go with it and feel good about that. Anyone debate with themselves often, change their answer a lot? This is something else I did all the time in school, so I totally understand if you tell me yes. Okay, it looks like several people are like, yep, I've been there, I've done that. My best advice for you is to not change your answer. To not change your answer. Now, somebody was asking on our website, what times are the tutor times listed? It will show actually in your time zone. So if it's like a schedule we post on social and it has a time, it'll be central time. But if you're looking at the website, it will actually convert it to your time zone, which is super nice. You can know exactly what time you're looking at. Oh, right. Now, again, one question at a time. If you start to miss several questions, don't start to panic, don't start to stress. If you're like, I don't know this one, now I don't know this one, that's going to build your anxiety. View them each as their own. View each question as a chance to be successful and to do the best you can on this exam. Now, breaks during the exam. You can take breaks, but I want you to make sure that you know the rules. So here's some big don'ts, and write these down. Please make sure that you remember these. Don't look at your phone. Your phone is staying in the vehicle. If you look at your phone, you're going to be asked to leave. You've automatically now just failed that test. Look at any study resources. You should have no study resources even out that day, let alone brought to you with the exam. They can ask you to leave. Don't go out of the testing center. So what there is there's a testing room and then there's the testing center. You have to stay inside the testing center. You're allowed to use the restroom on breaks. You're allowed to typically get your drink and your snack, confirm with your testing center, but don't actually leave the testing center. They're not going to go for that. Now, things you can do. You can get a drink. You can take a few deep breaths. I did confirm with NCSBN at a conference I was at last fall that you are allowed to have that snack with you. And then fuel your confidence, right? Sometimes we're our own worst enemy. Our negative mindset can get in the way of our success. If that's you, I want you to fuel yourself with confidence. What have you done to lead you to this point? If you've been studying, if you've been consistent, you deserve to feel confident and positive. You cannot discuss with colleagues during break time. No, you're not allowed to even discuss the NCLEX exam at all. Even once it's done, you're not supposed to be like, hey, this is what I had on my exam. That's a big no-no. You sign that you will not talk about the exam. You get the whiteboard the whole time during the exam, but if you fill it up, if you use it all, then you're going to have to get a new one. You raise your hand and they'll bring you a new one. You're not allowed to erase. So when you're actually taking the NCLEX, something to keep note of is you're not allowed to brain dump on the whiteboard. So when you get the whiteboard, you should not just start writing on that whiteboard. That's a big no-no. It's against the rules. At the start of the test, you're going to get this generic, not related nursing questions. They're just going to make sure that you know how the system works. You can do that tutorial at home. Just Google it. Google the tutorial at home. You can take it at home. It'll save you 15 minutes on that exam. So do it at home. They provide a calculator. You do not bring your own calculator. It's going to be automatic on the computer. Take a few deep breaths. Remind yourself that you've got this. Now, for the exam, you are going to have 85 items at minimum with a max of 150. You have to take that in 5 hours. So I want you used to kind of pacing yourself, timing yourself of, hey, this 5 hours, how long does it take me to get through 85 to 150 questions? Now, you're going to have 52 items that come from your 8 different areas of the NCLEX test plan. You're going to have 18 items, and this is at minimum, 18 items from 3 case studies. These are unfolding case studies. So the unfolding case studies are going to be 6 questions each, and they're going to test you on the 6 steps to clinical judgment as well as clinical judgment itself. And then with that, about 10% of your standalone items, by the way, can still be NGN items. So it doesn't mean that you're getting 3 case studies, that's it. It means you're getting 3 unfolding case studies, but you can have NGN item types throughout the rest of your questions. And then 15 random questions through that test are unscored pretest items. You don't know which 15. So what I would encourage you to do is I would encourage you to just do the best you can. Some of those questions that you maybe don't know the answer to are potentially a pretest item, so I wouldn't overstress those. Now, someone said, hey, does the water have to be in a plastic clear water bottle? You know, I'm just extra with my personality. That's what I would do. I don't know that that's what the rule says. I do know it cannot have writing on it. So as long as it doesn't have any writing, it should be fine. And they're going to have you leave that stuff in your locker outside of the testing room. You'll have to take a break to actually go get those things. But if it were me, because I'm extra, I would use a clear plastic water bottle because they will pat you down. They're going to make sure you don't have anything in your pockets. I would wear clothes that are very comfortable for you, ones that maybe don't have a lot of pockets in them. I do think it's helpful to maybe wear like a light jacket. So that way you could take it off if you do get too warm. For me, test anxiety, I get warm and I know that about myself. So it's helpful for me to have a layer that I can take off. Somebody said, is there any new rules or changes regarding NGN questioning patterns? Same as April of last year. So that launched April 1 of 2023. It's still the same now in 2024 as it was April of 2023. So we've had this change for over a year. And if you're a first-time test taker, what I want to actually tell you is pass rates have gone up. You should feel really confident. These NGN changes have really, really been great. We're seeing the pass rate actually increase. Now, with the passing standard, they're testing you if you have the minimum ability level to be a safe and effective nurse. They want safe nurses. So if you ever don't know the answer, choose the answer that keeps your client safe. Why? Because they want safe nurses out there. They reevaluate this every 3 years. So that last change came April 1 of 2023. They're going to reevaluate where we're at every 3 years to see if that standard needs to change. You have to perform at or above the passing standard. Near is a fail. Near the passing standard is a fail. You can have no categories that say near the passing standard. Someone on TikTok, Miss put, they just passed with 85 questions in 2 hours. Congrats. That is amazing. Looks like we've got several users on letting us know they passed. Ann Moss also said they passed in 85 using Archer. Congrats. Thanks for letting us know. That is amazing. Someone just watched the 3-day live review and passed yesterday afternoon. I'm loving this. Thank you guys so much for sharing that. That is amazing. Glad to hear that you guys are finding success with our product. That's what we root for. What drives us is you guys, your success. That's what helps us to improve. That's what helps us to do our best and show up each and every day. So next gen NCLEX, for those of you still a little unsure about next generation NCLEX, the best part about it, in my opinion, is the new scoring models. You get partial scoring now on a lot of these NGN style questions, as well as with Select All that applies. So a lot of times they're going to utilize the plus minus scoring, +1 right for each correct answer, -1 for each incorrect answer that you've added. Again, tons of different standalone items. There's drag and drop downs, multiple choice, multiple response, highlights, bow ties, trends, case studies, tons and tons of item types. Our QBank includes all of these item types so that you can practice them. Please practice them because once you get the hang of them, they get a lot easier. And so they're going to get a lot easier the more that you do that. All right. Any questions so far? Any questions so far? Awesome. Someone's taking in 2 weeks. Amazing. Good luck. All right. Well, let's go ahead and do a practice case study question. So a nurse is caring for a 41-year-old in the outpatient clinic, and the client presents with a concern for intermittent palpitations. He reports they come on suddenly and that he also gets dizzy, short of breath, and fatigued. Okay, I'm trying to think of what connections can I make, what things are, potentially going wrong here. What am I seeing? And then I next want to think about what other red flags are there? What connections can I make? So he reports experiencing 3 episodes of palpitations in the past week. He reports he's not taken any new medications, and there's no increase in stress. He reports full adherence to all his prescribed meds. The client is alert and oriented, denies pain. Skin is dry and flaky, especially around the elbows and knees. Lungs are clear bilaterally. S1, S2 heart sounds are oscillated. Peripheral pulses are palpable and irregular. Hint, hint, he reports feeling fatigued. Normal active bowel sounds in all quadrants. Denies any nausea or vomiting. No edema was observed. No jugular venous distension. So here's our vital signs. 99.2 Fahrenheit temp, heart rate is 73, but irregular rhythm. Respiration's 15, blood pressure 139/78, O2 sat 95%. Then our med history. Our medical history is so important, and here's why. that medical history is going to tell me what's expected, what is unexpected. So history of a myocardial infarction, history of psoriasis, so that itchy skin makes sense. Hypertension, that blood pressure now just makes sense to me. Urolithiasis, hemorrhoids. Okay, so that helps me with what makes sense and what doesn't. So which two client findings require follow-up? Which two things am I like, ooh, this doesn't sound quite right. This doesn't sound good. What do you guys think? What two things am I a little worried about here? Absolutely. Look at you guys go, experts here. The blood pressure, I'm not worried about. Why? Expected change. So we're good with this. Irregular pulse. Oh, shoot. What's the problem with this irregular pulse? Well, it didn't tell me that this individual had AFib, so I'm a little worried about an irregular pulse. S1, S2 heart tones are good. Palpable peripheral pulses are expected. Reports of palpitations, nothing in there told me that my client should be having palpitations. Dry, flaky skin is expected with his psoriasis. So I would say the irregular pulse and reports of palpitations. Nice job on that one. All right, so we get another question. Which potential problems is the client at risk for developing? All right, let's see how we do here. Someone asked, hey, do we use the full 5 hours? No, I don't say, I wouldn't recommend like taking the full 5 hours just to take it. Take what you need. I would not take a full 5 hours. If it were me testing, I would finish much quicker than that. But some people need the full 5 hours, especially if English is your second language. It may take you a little bit longer to really make sure you know what those questions are asking you. And some people are slower readers. I am a slower reader, I will say that. So that can sometimes add a little bit of time for me taking test questions. Okay, so with this one, what do I think's going on? Well, I'm a little concerned that my client might be at risk for AFib because of this irregular pulse we're getting. Bacteremia, no, that doesn't sound quite right. I don't think there's any indicators of that. A CVA, well, shoot, when somebody has an AFib, they're at risk for blood clots. And what happens when a blood clot goes to that brain? We could have a CVA. We could end up with a stroke here. Infective endocarditis, that really happens when bacteria enters into the heart. I don't see how bacteria would enter into this client's heart. Congestive heart failure, I would maybe think this if he was having dyspnea on exertion or an S3 heart sound. I didn't see either of those indicators. The pneumothorax, I would think maybe that, if we weren't hearing lung sounds on one side, but we didn't have that either, so I can eliminate that. Our answers are AFib and CVA. So what are they at highest risk for developing, and how do we know that that's our concern? Well, we've already answered this. They're at highest risk, okay, for developing what? For developing AFib. And how do we know that? Because of that irregular pulse. We've already answered this question. You guys could take what you already answered and pull it into this question. Okay, here's our next one. Let's do this one row at a time. So for each potential prescription, click to specify whether it is anticipated or not anticipated. So perform a 12 lead ECG. Do you think we should get a 12 lead? We think our client may have AFib. What do you guys think? Yes or no? Should we do a 12 lead? Yeah, absolutely. I'm making sure we're doing a 12 lead. What about blood cultures? Are there any indicator that my client might be septic? Because that's when we would take blood cultures. What do we think? Yeah, I'm not doing blood cultures here. I don't think it's needed or necessary. Should we get a complete metabolic panel? Do we want to see what those electrolytes are doing? Do we want to get that complete metabolic panel? Check out them labs. Yeah, I want to know what those labs are doing. Definitely a possibility that some of those are abnormal. Are we going to make this client NPO? Does having AFib indicate that the client should be NPO? Nope, not needed. Now, if they were having signs of a stroke, then I'm making the client NPO. But it didn't say they were having indicators of a stroke. It said they were at risk for a stroke. And then a CT scan of the chest. What do we think here? CT scan of the chest. Yeah, I don't really need a CT scan of the chest. It's not really going to give me any major data that's going to tell me AFib, not AFib. Okay, so here is our answer. Nice job on this one. Nice job on this one. If they were going to do anything, they would do a chest x-ray of the chest to look for structural defects of the heart, but they're not going to do a CT scan of the chest. That wouldn't make sense in this scenario. So then we get some new information, and this is what's going to happen in these unfolding case studies. They may give you some new info. So we get a 12-lead ECG. We find out they've got AFib, and the physician orders diltiazem, extended release 120 milligrams PO daily, and warfarin 2 milligrams PO daily. Why the warfarin? Why are we getting warfarin right now? Anyone tell me? Why would we be giving that warfarin? We're concerned about those blood clots, right? We're concerned about those clots that happen in AFib. So if this is my atria and it normally has this nice squeeze to push the blood out, in AFib, it's quivering. It's going like this, and there's no good squeeze at the bottom of that atria, and so these clots can develop here. Well, if one of those dislodges, we got problems. And so we're going to keep that blood pretty thin. So our nursing interventions for diltiazem. Do we need a pulse and blood pressure before we give it? Should we need to implement seizure precautions, or should we check a potassium level? What do you guys think? With diltiazem, what do we need? Good. We need a pulse and we need a blood pressure. Absolutely, you got it. Now, with warfarin, are we going to obtain an APTT, a platelet count, or a PT-INR? Anyone know the answer here? What are we going to look at? Good. Impressive. Great work, everybody. Yeah, we're going to look at that PT-INR. Absolutely. You got it right. So the nurse reinforces the discharge instructions with the client, and we want to complete the following sentences. So here, prior to discharge, the nurse should review the client's current medication list for what? Are we concerned about saw palmetto, vitamin B12, or magnesium oxide? Which of these do we want to make sure the client is not taking? Saw palmetto. Saw palmetto. Absolutely. Why? Because it has an effect on how warfarin is going to work. It can cause our client's bleeding to be disrupted. Absolutely. Nice job. So, because it could interact with that warfarin, the dietary education that should be reinforced is that the client should have a consistent intake of what? Folic acid-rich foods, vitamin K-rich foods, or iron-rich foods? Which one do we want to make sure that my client is having consistent amounts of? Vitamin K? Why? Because vitamin K is the antidote to warfarin. And so if someone consumes a ton of vitamin K, right, it's going to make it where their warfarin's not working. And so they've maybe adjusted the dose to be higher. So if they do that, and then all of a sudden I stop eating that vitamin K, well, now it's going to work too well and my blood's going to be too thin. And the nurse should remind the client that they will need a follow-up appointment to monitor their international normalized ratio, their INR, as the treatment goal is what? What do we want the INR to be between? 2 to 3. You guys got it. Impressive. Nice work. You got it. Now, to actually go through more questions like that, do mock NCLEXs, you can sign up for small group tutoring. If you're like, Rachel, that $75 an hour was a little bit steep for private tutoring. Small group tutoring is another option. It is so much fun. I love doing small group sessions. We have 2-hour NCLEX reviews. We do farm reviews. We do kind of a little bit of everything. So they are amazing. They're really fun if you are interested in those. Now for test items, I want to talk a little bit more about this, but with the test items, you're going to have those 15 unscored items. You don't know which they are, So you're going in and you're doing the best they can. Now, somebody just asked me about that last question. Hey, the client should have a vitamin K rich diet, should be consistent. So if they don't eat any vitamin K, they should keep not eating it. If they eat a spinach salad every day, they should eat a spinach salad every single day to make sure that their vitamin K is consistently brought in, that it's not a big change in amounts. Okay, so with this exam, it's going to be a CAT exam, which means it's adapting to you. So what it's going to do is it's going to see how you're doing and adapt. How I like to think of this is it's going to give you every chance that it can for you to be successful, for you to pass those different areas of the NCLEX test plan. Remember, don't self-evaluate. Kind of how I like to think of this, let's say you're watching a TikTok, and as you watch certain content, TikTok is like, hey, here's the stuff that this person watches. We're going to send more of that over. It's kind of like that, right? It's adapting to you, but it's giving you every chance you can to pass those different areas of the NCLEX test plan. Now, there's some terminology that you're going to see on the exam. You're going to see the word client, not patient. I know in the hospital, we still use the word patient a lot. You may hear me say the word patient sometimes, but the exam will specifically utilize the word client. An order is going to be any treatment that is ordered by that primary healthcare provider. It may be an intervention, it may be a remedy, it might be a treatment. Prescriptions would be medications. And then they're going to utilize for a doctor or a primary care physician, they're going to say primary healthcare provider. That's the terminology we use, stays consistent on the exam. A nursing assistant will be an unlicensed assistive personnel, UAP. That's the exact wording they're going to utilize. And then anything that indicates prioritization will be bolded. So there's some specific terms they bold: immediately, highest, initial, next, refute, increase, decrease, and essential. If you see those bolded, you should really draw to that because it's an indicator there's something a little more important there. Now, after the exam, I want you to take a nice big deep breath. It's going to feel like 2,000 years later, but it's okay. And before we get to those scores, you're not talking about that exam. You're not going to your friend. You're not going to your instructors that you had. You're not coming to us and telling us what's on this exam. Don't go do any anonymous posts. You have signed that you will not talk about it. If you get caught doing that, you can lose your nursing license. I want you all to take this very seriously, that you are not discussing the exam. Now you can say like, oh, that was tough, I passed, whatever. You can talk like that, but you're not allowed to talk about any of the content, what you actually saw on the exam. Now, with your scores, these are the two options that I would utilize: your quick results or your official results. So quick results are available 48 hours after you've tested. You sign into Pearson VUE, you go under my account, you click quick results. They are for purchase. I want to say it's like $7 or $8 to buy them. It's not a lot. Now somebody said, hey, if the question starts to get really hard, is that a good sign? And if they go back to easy, is that a bad sign? Don't do that. Don't self-analyze on that test. You're setting yourself up to stress out, to be anxious, because you might not self-analyze correctly, and then you're building anxiety for no reason. The exam is adapting to you, but I don't want you trying to figure out, oh, am I getting them right because they're getting harder? Or, oh, am I getting them wrong because they're getting easier? A question that's easy to you might not be easy for everybody else. A question that's hard for you might not be hard for everyone else. Don't self-analyze during that test. Then your official results will be available within 6 weeks after testing, and they'll send them directly to you. Whew. All right, guys, we made it. What questions do you have for me? Good luck. It looks like somebody is going to test tomorrow. Several of you. We are rooting for you. We wish you the best on that test tomorrow. Any other questions? Someone asked about the pop-up, the good pop-up, the bad pop-up with the Pearson VUE trick. We personally don't say yes or no to that. It's inconsistent if it works or it doesn't work. Pearson VUE does not claim that that is a reliable trick, so we don't claim that either. If you want to check it, you can, but we personally, I would prefer you just wait 48 hours. People do it wrong so often, and they think they failed when they haven't, and in the last like few months, people have been saying it's been inconsistent. So I personally would just wait and do the quick results. Okay. Tested on the 12th and passed just 2 days ago. Awesome, Pendo. So glad for letting us know. Okay. Someone said, does it mean it's true if questions get harder that you're getting more correct answers? Yes and no. It's so hard to self-analyze. That's why I just say it's not worth it. I would personally not self-analyze. Someone going on the 22nd. Okay. So lots of you are saying, hey, I'm about to test. I'm scared. I'm worried. I'm fearful. So I don't want you to be scared, worried, and fearful. A little bit of test anxiety is good. It can motivate you. It can help you be successful. But guys, you've been prepping for this for years. You went to nursing school. You have been prepping for this for a long time. You've got this. Prep, make sure you do your final touches, get 4 highs or very highs on readiness assessments. And that's it. Go do the best you can. Don't let all these outside stressors hold you down. If you let that mental battle win, it can be very hard to be successful on the test. Now, okay. So, sorry, my computer just went off for one of the lives. Now, the next thing I want to show you is how to sign up for tutoring. So if you're going to sign up for tutoring, what you're going to do is you're going to open a tab and you're going to go to Archer Review Tutors. You're then going to click on tutoring. And then you're going to go to private tutors and click on NCLEX. Once you're here, you can scroll down and you can see all the tutoring available. So let's look at tomorrow. Shelly has got sessions tomorrow in the morning. Elizabeth has safety and infection control. Jennifer has a session in the afternoon. Allie has evening sessions. Guys, Allie is incredible. She's amazing. She is so patient. She is kind. She does great with test anxiety. If you need an evening tutor, she would be the person I would choose. And then Lauren's 2-hour NCLEX review is full for tomorrow. Allie's got more openings on the 16th and then as well as on the 17th if you guys are looking for them. Allie is kind of our dedicated evening tutor. She has tons of availability because I know so many of you work days and you need some evening option. There's also that weekend option as well if you need the weekend. Good luck. Glad the 3-day review was helpful. When you do intense prep, you'll be paired with whatever tutor is teaching that cohort. We just have 2 tutors that teach intense prep. The percentage on the RA is not what I would focus on. Focus on if you get a high or very high. A private tutoring session, each booking is 1 hour, but you can book several. And what I will say is when you book, so like let's say I was going to book 3 of them, I would get 10% off, and it's going to tell you, and you can mix and match which tutors you're signing up for as well. You can mix and match small group sessions, private sessions. So let's say I was going to also sign up for this. I signed up for 3 sessions, 2 privates and 1 small group, and it will add that discount. So you can mix and match to get the discount, which is awesome. It's amazing. Highly encourage it. If you're not sure about a tutor, look at their reviews, look at their feedback. You can really tell a lot from what students have said. So all that feedback is listed down below here for you guys. So you can see reviews that people have gotten from other students before. Someone said, how accurate is getting a very high on a readiness assessment? Consistency is what's important. So 1 very high, nah. I want you getting 4 consistently, 4 in a row, not back to back in the same day, but let's say you take one Tuesday, Friday, next Tuesday, and the next Thursday. 4 of them should be high or very high consecutively before you take the exam. Consistency is what's important. Do we do NCLEX only? So, we do have a TEAS division as well, and FNP has started doing free webinars as well. So we have kind of lots of options of where we're at. But yes, we also, so mostly the NCLEX, but we're starting up TEAS and FNP. They do free webinars throughout the week as well. Borderline means you're close on those readiness assessments, but you're not quite there. Keep working. Maybe book a private tutor session so they can analyze those scores and help you get those borderlines up to high. All right, that's all we have time for. Thank you so much for joining us. If you have any other questions, you are welcome to email nclextutors@archerreview.com. We typically do these every other week. So every other week, you typically can find us live. Thank you guys so much for being here. Have a great day. Good luck on your NCLEX. We are rooting for you. Thank you for being a part of the Archer Review family. Bye, everybody.